Now, you see a dog bite incident. First, keep yourself safe. Step back and make sure the dog cannot bite again. Check the person's responsiveness and breathing. If they're unresponsive, call emergency services now. For responsive patients, control bleeding with firm, direct pressure using a clean cloth. Next, wash the wound immediately and thoroughly under running water with soap for at least 15 minutes. Irrigate gently. Do not scrub aggressively. If available, rinse with a povidone iodine solution after washing. Elevate the injured limb if possible and cover the wound with sterile gauze. Do not close the wound at home or try to remove deep embedded objects. Seek medical care. Because dog bites can cause serious infection and because a rabid or poisoned animal is possible, the victim must see a clinician right away for antibiotics, tetanus check, and possible rabies post-exposure prophylaxis. While waiting for help, stabilize the limb with a padded splint, check circulation in fingers or toes, and stay calm and reassuring. Avoid common mistakes. Do not suck the wound, do not use dirty cloths, and do not give water or food to someone who is unconscious. Get urgent medical evaluation and report the animal to local health authorities.
These are basic first aid steps meant for temporary help. Every situation is different, so always seek professional medical care. You are responsible for how you use this information.